I felt like in the process of adaptive design that the learning to see phase and the power of observation was very powerful in my learning. As a facilitator now of the work, we've had the opportunity to be in clinics and create a culture of trust and optimism along with providers and get that provider engagement. So most recently, we were working with a clinic in one of our regions where providers actually wanted to observe one another. It was an aha moment for us, the first time that had happened in our observations, but very powerful that we received that much engagement from physicians that wanted to learn about their partner's work. We felt like the videos were very helpful, applied to our daily work. We felt like we were truly engaged with Dr. Kenagy and the work that he was doing. One of the great positives that we had was we could utilize the program at our own pace. So we were not on a time schedule of we had to get so many modules done in a short amount of time. So we could complete a couple of modules, watch videos, and have some group discussion around some of the learning that we had before we advanced on to further videos. But we got a real sense that we were very well supported and very well engaged from the video modules and able to really apply that to our daily work. So we've had the opportunity to utilize adaptive design in a focused learning event type program where we can bring multiple learners in together from a clinic to improve on some of our measures for our quality. So for an example, we have had a clinic who wanted to strive for performance on colorectal cancer screening. They were not meeting the performance target that we have for our organization, and they were able to bring in a physician, a nurse, a front office staff, their lab person, and talk about what can we do to improve and work through the A3 process in a focused learning approach. So we really have utilized adaptive design in those learning events to be able to create better value for our patients, and we can produce better value and demonstrate those outcomes. As an organization, we feel it's very important to have adaptive design training prior to implementation of our patient-centered medical home product. As an organization, we have started to deploy adaptive design at least 3 to 4 months before the clinic starts to go into patient-centered medical home redesign. We've had very good success with implementation by preparing that clinic staff for the change that will be happening in their work environment to make sure that we have a smooth transition through implementation, and we're there to support them with anything that we can work through during that care transition. It's a great opportunity to see adaptive design real time in the work. So we have had employees that maybe were not on board at the beginning of implementation, but they see their coworkers starting to get engaged and see the work that we're doing with them, that they feel like this is something they want to be a part of too. So having those early adapters within a clinic have been very important to us to kind of bring the rest of the group together to start to build that trust and optimism within that clinic setting.